Everyone, we're just gonna wait another minute and then we're gonna get started. Thanks. Thanks for joining us. Okay, here's Gail. Okay, should we get started?
I'm
Gail,
ready.
ready? Okay.
Thank you very much. I want to thank everyone for joining us for 3 o'clock on Tuesdays. As you know, this task force focuses on health and recovery efforts. And we're going to focus today on the city's home delivered emergency food distribution programs, particularly those serving older adults, and finding out about social workers and counselors, what they are seeing with the new school year. Those are sort of the two topics of today, and we'll have lots of questions. Last week, we know that there's a point where testing is once again key. I have to say, I know that from own personal experience because I'm out so much. I've often get a call, you have to go get tested again because you were around so-and-so. It's pretty commonplace, I have to tell you. And then I run around trying to find a testing place. We're waiting to hear from families who have been, some families have been waiting times for testing at public and private sites. But I have to tell you, I also have people who have been able to get at city sites immediate testing. So it's a mixed bag. My understanding is that pre-K and K kindergarten students do not get tested in school, but we do know that there are sites restricting testing to children 4 and older. And there are city sites and health and hospitals for 2 years and older and even require proof of age. I guess we just need to get that straightened out. I think people don't know exactly where they're supposed to go, and that needs to be clarified because like I said, I know some families who went to the city MD and they waited and waited. I know other adults who maybe young people could have gone to city sites, which seem to be the absolute best, and they had no wait whatsoever. So that needs to be at least understood educational wise. So we are very honored to have Commissioner Lorraine Cortez Vasquez, Commissioner of the Department of Aging. She has been the 63rd Secretary of State of New York. She and was appointed in 2019 as the DIPTR Commissioner. I remember she came to John Jay College for one of our conferences on aging pre-pandemic, and we were very, very appreciative. And I know that she has worked really, really hard with the nonprofit providers to address the unbelievable needs of homebound New Yorkers all during the pandemic and beyond. So I think we want to hear from you, Commissioner, and I thank you very much. It was very nice to see you in the Bronx. I never go to the Bronx, but I actually saw you in the Bronx recently, and that was very exciting. So I think we want to hear from you. I want to say, I know you also recently completed the RFP process, request for proposal, for the older adult centers. To me, they're called senior centers. I know it's not the right term. I know you don't like it, but I keep forgetting. And the north. I keep forgetting. I can't call it that, but that's what everybody calls it. Anyway, Commissioner, and the floor is yours. And thank you very much for joining us.
Well, first of all, thank you for having me. And yes, it was great to see you in the Boogie Down Bronx. You need to come up. You need to come up more often. It's a wonderful place. But you know that I'm an East Harlemite, you know, that's where my roots are. And then I'm a Bronx transplant. So yes. I'm happy to be here with you. And I'm really happy that you mentioned those 3 things, because that's exactly what I want to bring you up to date on, everyone on this call. I want to highlight first the Get Food transition, which is of great interest to all of us. And also I want to give you an update to whatever limitations I have, but an update on the RFP for, yes, older adult clubs. Even I, who came up with that name, well, I didn't come up with it, But even I, who was endowed with that name, have still called it senior centers every now and then and have to correct myself. And the NORCs, the naturally organized retirement communities. And then also to give you some updates on what we're doing with technology. All right.
Great.
So let's, for everybody's, for the sake of time, I want to just, Get Food announced last week and inform some of its clients that the last time that people would be able to register was October 1st for Get Food. And that the home delivery program would stop delivering meals come October 15th. And that's starting, but when we heard about this about a month and a half ago, about 6 weeks ago, DFTA immediately started working with its providers to ensure that anyone who was on Get Food that was known to the DFTA providers would get contacted. There are roughly 16,000 older adults involved in the Get Food program. When the program was stopped accepting new enrollments on October 1st. Of those, about 9,700 were previously known to DFTA. Either they came from an older adult club, or they were a home care client, or they were someone who was a case management agency or part of a NORC. When we heard the news, immediately the DFTA providers, our not-for-profit network of agencies, all 300 of them, all 300, which includes the centers and some social clubs, immediately started calling the Get Food participants who were familiar with their program. And I must say that they've contacted more than 85% of those people. And of those people, thousands of the 9,700 have said that they're happy to return to the center when the Get Food program starts. And those are the ones going to the center. Now we also have, and so that's great. And, and what we've set up is a grab and go as well as a meal, they can come back to the center whenever they're ready. But because of COVID, we still have a 25% capacity, but they can always get a nutritious meal through grab and go. So the food insecurity will be addressed. In addition to that, the home care agency and the case management agency started calling those people who we also know were put on Get Food, who were home delivered meals clients, who needed services, to make sure that they could be transferred to the home delivered meal program. And of those, we've already contacted more than 70% of those. And most home delivered meals program have been able to absorb the extra individuals. Right now, we're working on a plan with Get Food for those other home delivered meals program. Get Food, however, is calling those who were in Get Food that were not known to DFTA. And these calls include an initial screening for needs. They will be asked, were they able to still shop for themselves? Do they still need the services? And this is being done through one of the city's agency called HRO, who is sending letters. Many of them have not been reached, and that is a concern for us because we want to make sure that this is a seamless transition. So they've also added robocalls and text messages and emails so that those clients could be contacted. If any, and we have been really fortunate to set up a program for many of those individuals that were Get Food clients that were not affiliated with the Department for the Aging's network of agencies. We've secured 3 local service providers who have agreed to manage contracts to continue delivering those meals. We're really pleased because these are 3 contractors, one who knows senior services, who know about meals because they've been involved either in a senior center or a home delivered meals provider themselves. And they have an affinity for this population. So it is we're trying to make it as seamless as possible. If an individual indicates that they can continue to need assistance with meals, they have three options. They go back to the older adult club for grab and go. And if they're home delivered meals program, they will go back to a home delivered meals program. And then there is what we are calling the recovery program for those who have not been affiliated with DFDA. The recovery meals will provide 7 meals a week and will run through the end of June 30th, 2022. It's a temporary transition program. I want to be real clear for everyone. This is not a permanent program. It is just a temporary transition program. And from my lips to God's ears, this pandemic will be over by June 30th, 2022. And we could all resume a normal life. So there is this temporary program for those who are currently registered in Get Food, and so that they can continue getting food if they need it. So that's it about Get Food. So we'll hold questions for later. Gail, or do you want to answer?
Yeah, unless anybody has one right now. I guess one of the questions I have is the other possibility too is to try to get some of these older adults to participate who are not previously DFDA, particularly if they have
Yes.
an exciting, for lack of a better word, older adult center, because we want to try to get more people to participate in the older adult centers, right? I mean,
Absolutely. And one of the things, and I'll talk about that when I talk about the RFP that we built in this year in the RFP, was an outreach plan just to, because we know that they're anywhere between, depending on the number went as high as 140,000 older adults receiving Get Food, of which about 44,000 of those were DFDA known. So that's about 100,000 people older, over the age of 60, who were not known to any provider. All right.
Yeah.
And now they have have that potential to go to the senior centers. You
Right.
see, I said it. The older adult. All right.
Yes, I know, I stumbled.
All
All right,
right.
so that would be unless anybody else has a question, I think we're okay. Jessica or Shula? No?
I just have one quick question, Commissioner. Just in case, thank you so much for laying out how the outreach plan for older adults who are currently in the program. Just in case someone, either hasn't received a letter or a call yet, or maybe is confused by it, how should they follow up in case they are still in need of assistance to be delivered to their homes?
I think that they could go back to Get Food and let Get Food know of their interest. Their point of entry and point of contact should always be Get Food.
Okay. That's
All right.
Yep.
Good.
Okay, now we'll go to RFP. Thank you so much.
All right. So I'm really excited. The conversations have already started with some of the contractors. First of all, I want to give you some basic information. When we started this RFP, we were looking for first, and I know that there was a lot of conversation about whether we should have an RFP or not. But I'm so pleased that we did, because we had not issued an RFP for senior centers or for senior centers particularly in over 11 years. Yet the world had changed for older adults in New York. It's vastly different than it was 11 years ago. The demographics were different. The location, the service gaps were different. The age span was different. So here we had a changing population and our programs were status quo. What we did with this RFP was, one, start trying to address service deserts. One, particularly looking at the demographics. If you know that the white population and elderly for the last 10 years has stayed flat and is in fact decreased. The Black population has grown by 75%. The Latino population Latino, Latina population has doubled, 108%. And the Asian American Pacific Islander has tripled in growth. It went from 60,000 to 120,000 or 130,000. So that means that, we need to have service providers that have an affinity with each one of these groups. And so we were looking to also build that capacity for new providers who had the cultural competency to address some of these older populations. The other thing that we looked at was those neighborhoods that were the most hardest impact, what we call the racial inequity communities by COVID, to make sure that those programs, those communities had the ability to grow and also serve older adults. So we're working with MOX. We notified all of the proposers, whether they have been or have not been deemed eligible for an award, and we're starting those negotiations. But here is what you need to know. Another thing you need to know. The city invested $48 million for this expansion, something that had not been done in 20 years, all right? I am extremely pleased that this administration has made that kind of an investment in older adults for a total of $58 million, because they gave us $10 million that were promised earlier. If you hear Margaret Chin say it was owed to us, a Councilwoman Chin would say it was owed to us, that we got the money so that this expansion is possible. When we issued the RFP, we had 249 older adult clubs and 28 NORCs. Post this RFP, we will have 272 older adult clubs and 36 NORCs. That is an expansion of 31 new sites to the network. That is great news, all right? And here is even better, here is what I think are some of the exciting news also. We will be baselining 13 current discretionary funded centers to our network. And it was something that I remember Council Member Danny Drum and Council Member Chin said, Lorraine, you've got to make an investment in those small ethnic groups and those smaller community groups who have been sub-sites, and you need to make sure that they can become competitive should there ever be an RFP. We worked for over a year with those groups, and we're happy to say that many of them now will be fully operating programs. So, which gives the city council, which you will now be interested in that beginning January 1st, borough president, it gives the city council the more new opportunities for the discretionary funding, because some of that money has been baseline. So we have gone from 277 service providers in this community-based program to 308. That is unheard of, at least in my lifetime in this aging services, all right? And I could say, with the exception of one provider, not in your borough, with the exception of one provider, everyone who's a current provider has been designated to be an awardee who is now in contract negotiations.
Great, that's great. We have,
And we also
we have
have
such
growth.
good ones. We have such good ones in Manhattan. That's why.
You have great ones in Manhattan, and we have great ones in the Bronx and fabulous ones in Queens too. So that's it for the RFP. I mean, it's all upward trend. It's all, forward movement. But one thing that you, and I know that you've been a strong advocate of this, is technology.
Yes.
And we had the 10,000 tablets that were given out during the pandemic to public housing residents.
Yeah.
And so we worked very hard with the Mayor's Office of Technology and with OMB, so that we've now got funding for another 10,000 tablets for non-housing authority residents. So if you're not a housing authority resident, and that information was just given out to all the senior centers with an allotment anywhere between 10 to 50, depending on the group and depending on the size and depending on the neighborhood. We were able to give you tablets that you will distribute to your clients, and they will have 6 months of free internet.
Yeah.
To continue, and we also will have a continued training around that. So, and we're focusing on what we call the tree neighborhoods, the low income, racially, where we've had racial inequity for long periods of time.
Yeah.
That is the first area where we're doing the Wi-Fi. And so we're also doing a lot of outreach, encouraging folks, and we really want your partnership in this, Borough President, which is to apply for the federal broadband
Yes.
rebate program
Yeah,
for internet. That is key. We want everyone in New York who is over the age of 60 to apply for that.
yeah.
So
very-
those are,
Very
and
beneficial.
yeah, so those are the pieces of news that I wanted to share with you. And should I talk to you about the mental health expansion, or do you want to talk about that?
No, if you want to, that's fine. I just want to say about the internet, because I do know a lot, and the devices. I'm delighted that the devices for the non-NYCHA will be going to the senior centers, because then they can help make sure that the device to the right and blah, blah, blah. I mean, I don't know who's doing the follow-up on the NYCHA. You know, some of it didn't go into the person's home. I can tell you about boxes downstairs, blah, blah, blah. So it's really important to have somebody, in addition to the older adult, participating in this opportunity.
But
Because,
the lesson that we learned from NYCHA was exactly what you said. When it was centrally operated, identifying people was a challenge, as
Yeah.
many things are with NYCHA.
yeah,
but-
exactly.
But what we did in this one is give it to senior centers for older adult clubs who are the trusted partners.
Exactly. And I, you know, if we ever do NYCHA again, we would have to do the same, because it's always a challenge with NYCHA, as you know.
Right.
Leave it at that, because I don't know who got
Right.
it, and I don't know what the follow-up is, so who knows?
Yeah.
So Jessica and Shula, do you want to do mental health now? Would that be helpful? Jessica, Shula? Yes? Okay. Commissioner, go ahead. Thank you.
Great. So we just, we started out when we first got here, we had 25 geriatric mental health programs. And since then, we've been working with formerly known as Thrive. I feel like Prince, formerly known as Thrive, now known as Community Health Program. Thrive has been generous in helping us expand geriatric mental health programs, because they have shown, and we've demonstrated with data, the impact and the success of those geriatric mental health programs. So we just received another $3.2 million from the Office of Community Mental Health. And we were able to grow our 25 to 44. They gave us some additional money. And we also got $2 million from the State Department, from New York State. And now we're able to go to beyond the 44 to 88. So we went from 25 to 44, and now we're going to have 88 outlets providing geriatric mental health. Our goal, as you know, like you, rely a lot on the older adult club. They are the front facing. Sometimes their facilities would not be deemed, adequate or appropriate for a mental health program, but they can be an offsite. All right. And so we're coming up with different models, but the goal is to make sure that every older adult club has access to mental health services. I can tell you that they've made a tremendous difference. And we saw that difference during COVID, the impact that they've had on many, many people, and helped us form our wellness calls and a lot of the services that we provided during mental health. So mental health services are provided to anyone 60 and over who do not need to be a member of a center to receive services. And what we can do is give you a list of where the mental health providers are, the sites are in your borough,
Yep,
so that you could have access to those licensed clinical professionals who are providing this.
that'd be great. I know the NORCs are really key to that also because it's
Yeah.
very non-judgmental. You know, you can be doing the knitting club or going to the museum. And then somebody is able to identify this isn't going well. And the NORCs are really, really good at that without anybody knowing.
Yeah, the Norks have been really excited. You'll be happy to know that we were able to retain most of the Norks in your borough, and many of them were baseline. There's some that will still exist, and they will rely on, I mean, one or two, I believe, who will rely on the discretionary funds. But it is great to have increased them from 28 to 36.
Yep, I'm a big NORC fan, so that's huge. It's such a great way to grow older without anybody bothering you, and you don't have to do anything. Just get support when
Yeah,
you need,
and you know,
when you need
and
it.
it's aligned with this community plan. You know, the goal is, our 5-year strategic plan is to expand community-based services to avoid institutionalization. You
Yep.
know, most people want to grow old in their community.
All right, go ahead. Anybody have questions? It was an amazing overview, and I'm very appreciative.
Right. And I want, you know, because the Get Food transition is going to be a challenge. But I have a lot of confidence in the 3 providers that have been contracted to subcontract and provide the Get Food meals. I want us to be, you know, supportive of them. And if we hear of any concerns, let's talk amongst ourselves, get to them to make sure that we can make this seamless as possible. But we don't need a lot of controversy around that, because I believe that these providers have the knowledge and the expertise to deal with this population.
Okay, we will be glad to call you when we hear about issues. Needless to say, they call us in 2 seconds. when they-
Yep, I know that.
They all have our phone numbers, I swear. But are these, each one is citywide of the 3, or how do they divide it up?
No, the way they, of the 3 who applied, 5 applied, 3 got it.
Okay,
They identified the borough or the boroughs they were interested in serving, so that there's one designated for Manhattan,
okay,
there's one designated for Queens, and then there is one who's designated for Staten Island, Brooklyn, and the Bronx.
perfect. Okay, so we'll get the name from you from the Manhattan. And then for those who are asking, we'll get the listing of the NORCs and the listing of the mental health providers. Val, I know you asked about that.
You got it. You got it.
We can do that. I
All
want
right.
to thank you. Another topic that has not really city related, but I get calls all day long. This is not what I would want, and I'm not necessarily interested, but I don't know what you call it, inexpensive, but how about less expensive assisted living? At least in Manhattan, it's like $25,000 a month for some of these places. So I don't know, is that something that ever comes up on your radar, assisted living that is not-
Assisted, anything related to housing always comes up on our radar, and we're
Oh.
always strapped. And you're right, we need more affordable housing, really affordable housing.
Yeah,
And we also need affordable nonprofit run assisted living.
exactly.
You know, the $25,000 that you're talking about
God,
is out of reach for about 80% of the older adults.
yeah, I know. I
um,
find it shocking, to be honest with you.
Yeah, so if we had more opportunities in the nonprofit sector, it is, you know, a excellent alternative to nursing homes.
Yes, exactly. And the other
But
thing,
think about it. Think
Right.
about this, council member. I mean, borough president. I don't even know what to call you anymore, Gail.
Gail's fine, Gail's fine. Go ahead.
Think about it. It costs $185,000 to keep a person in a nursing home.
Yes,
You're talking about a $25,000 assisted living. Would it not make more sense if that was fungible? And it also cost us, we estimated anywhere between 37,000 and 51,000 to give wraparound community-based services, transportation, home delivered meals, home care services. Imagine, wouldn't that make more sense to start making sure that our funding goes in that direction
Yeah.
rather than an institutionalization? There lies a real legislative gap and a real legislative rub.
Absolutely. And the other thing is, just in terms of homeless and seniors, so DeRote, which is one of my favorite organizations, has always had a homeless senior program. And they're gonna do something else because, and I think Wishfish will take over their portion. But they told me the other day, because of the lack, as you suggest, of senior supportive housing for formerly homeless permanent. It used to be at their temporary, I don't know, 6 months. Now it's 18 months. And it's
Yeah.
because, so what I'm saying is what I'm pushing the mayor to do and current and future is the hotels. We're gonna go all over these hotels. We've got to get some of the SROs in the hotels to be converted for quality, nonprofit run, permanent housing for seniors.
I
Because it
remember,
is absolutely-
yeah. I remember in the Bronx and in East Harlem, one of the things that low-income factory workers, of which my uncles were those individuals, they always had single-room occupancy buildings.
Yes,
And that was, they would pay and whatever it was in those days, I'm dating myself, like $30 a week.
yep,
And they would have a room and a bathroom and a shared kitchen.
yes.
And that was a way of life for many people. And there's no reason why we cannot consider single room occupancy as a viable solution.
Yes, I'm a huge supporter of it. So just so you know, we're meeting constantly to try to make these become realities. People who grew up, I have many friends and staff members who grew up in SROs.
Yeah,
And they're doing quite well. So just so you know, we're pushing for that also.
yeah. And the other one, DeRote is so is Project Fine and Elmcor, who do exceptional work with the homeless population,
Yes.
so
Yes.
I just want to give a shout out to them too. And they're right there in the heart of the issue,
Absolutely. Well, thank you very much. It was a great overview and you have some great programs. And I really appreciate the fact that you've made such strides and increasing for those communities that need it the most. But just senior, we're all, the population is just growing, period. And
Right. And my motto, leave it better than what you found it.
Absolutely. And have fun while you're doing it, which is also
And
great.
laugh all the way. Absolutely.
I know I can learn. Thank you, Commissioner, very much.
Thank you so much. It was a pleasure.
Excuse me. I would like to add, what about adding a overlay of using that funding for an insurance purpose and creating an insurance account? So, and starting a program like that early in like 3K and throughout the schools to create a financial literacy and use those funds once there is a senior who is in need of it to purchase to purchase and cover the cost of any sort of long-term or senior care. Insurance will cover all of that, and people who start early and they have it paid off and they have a lot more security, and a lot of people are blindsided when there's no reason for that. So I mean, that's like a real viable, that's easy to do. And I just have to throw that out there. I'm very passionate about this issue. Thank you.
Thank you very much. I appreciate it.
Yeah, thank you.
All right, so next we're going to hear from David Garza, who is the Executive Director of Henry Street Settlement. And I think he's joined by Kelly Lennon Martucci. I have to say, having spent quite a bit of time with Henry Street Settlement, we have both Mr. Garza and Miss Lennon Martina this summer, Martucci this summer. I could not be more impressed. I go around, I could have Henry Street Settlement written all over my face and forehead. It's not only the amazing mental health programs, which I know you'll talk about. But David Garza did a rap song the other day at their street festival that actually took the entire group in. It does unbelievable accolades, applause, very exciting. So I do call him the coolest settlement housing fund director. I have to.
I don't know, as a union settlement kid, I don't know.
No.
Henry Street is okay, but union settlement was like the bomb. But with that, Henry, David, can you forgive me, but I really have to drop off. Is that okay with all of you?
That's okay. We'll forgive you, but
Okay,
the settlement house thing is a place-based thing. So no worries that you were at Union, no one that you were at Union Settlement. You were uptown. That's perfectly understandable.
David knows that he's fabulous at Union Settlement, but he can't do a rap song like David Garza. I can tell you that right
no,
now.
I don't think Dave Nocenti knows rap songs. All right.
Thank you, Commissioner.
Bye-bye, thank you.
All right, go ahead, Henry Street. Thank you very much for being here.
No, thank you so much, Gail. Always grateful to be with you in any forum. And I reciprocally refer to our borough president as the hardest working elected official in the city. And I think anyone on this call and anyone who's been anywhere near Gail knows that's facts. And I'm really honored to be joined by my colleague, Kelly Lennon Martucci, who I will do what I can to get out of the way pretty quickly, like any good leader, and let the talented people on the front lines really explain some of the color commentary on the work. So we were invited today to talk about the challenges that our youth are facing as part of the recovery from COVID-19. And for those that aren't familiar with Henry Street Settlement, we have 18 sites on the Lower East Side. We're one of the few settlements that stayed directly in the epicenter. All 18 of our sites are within 1 square mile. And the spectrum of our services runs from early childhood education, and in fact, actually, prenatal moms all the way to 102-year-old seniors. So I was grateful to have the opportunity to hear what the commissioner had to say about senior services. But with today's focus on children, youth, and families, we serve them at every turn. We serve them in academic settings. We have programming in early childhood education, elementary level, middle school, high school, after school, college success. We serve children and youth in our family settings, at our parent center, in our homeless shelters, through our food distribution programs, and otherwise. We serve children and families in our sports and rec programming, at our community centers, in our cornerstones, in our sports leagues, and all across the settlement. In all the youth and families that we've met, they are meeting trauma at every turn, and it's manifesting itself in myriad ways. First of all, in a neighborhood like the Lower East Side that has high levels of income disparity, high levels of sustained poverty, high levels of population density, high levels of housing instability, our children and youth have come into the pandemic traumatized, and the pandemic itself has added an additional layer of trauma onto that trauma. And then it triples and quadruples when you think about literally in every direction they go, right? All the trauma of going remote, the trauma of coming back, the trauma of transportation, the trauma of multiple directions. And it's manifesting itself behaviorally, social, emotionally, psychologically, academically, and at every age, 2 to 22. We've seen the full and unimaginable spectrum of trauma, from social isolation to suicide. And it's been a horrifying 18 months. And we think that a lot of the trauma is yet untold. We think that it's only going to continue to deepen, and that it's going to continue to intensify. And what we're committed to do as a settlement is to have as many place-based interventions and place-based services to meet these young people at all those points that I described where they are. At the core of our settlement philosophy is always to listen and observe, and then to be able to act and respond. And when it comes to youth and children, they don't often get pulled into conversations around program design or services. They don't vote, so they don't get to necessarily put in position who's going to make policies that have a direct impact on them. So we have a responsibility to raise their voice and to sometimes be their voice. And I'm grateful that Kelly reminded me of that at its most literal manifestation, which is in our schools. And I'll let her add to that when she talks about the work that she's doing directly at the settlement. But from a broad-based perspective at the settlement, we've done a lot to try to meet all those different trauma points. We've increased our mental health offerings at every age. As Gail mentioned, we hit the street and had a lot of family engagement and outdoor programming throughout the summer. very deliberate, very intentional activities where we connected with over 5,000 individuals and families all summer to get them resources, to get them information, to get them connected to professional help wherever needed. We have a number of initiatives from Project Hope, where we have 18 crisis counselors out in the street, literally meeting parents, meeting families, and turning them back toward Henry Street services wherever possible, to our Youth Opportunity Hub, where we have social workers embedded in settlement houses across the Lower East Side to really amplify and exponentially increase our capacity to meet the young people where they are. And in terms of not only raising awareness and ratcheting up the services, we're also intensifying the advocacy that we get to do. And so we're the first ones to express very directly that we need more resources to be able to increase the mental health services that we're providing. We need to continue to hit the street and engage people in creative ways. We need to increase our advocacy efforts. That's why we're delighted to be here today. And we certainly need to evolve our practices as the experiences of our young people are manifesting themselves in our programs, in our schools. And I'll ask Kelly to give you some insight as to what's going on in our school-based programs. We are in approximately 10 to 12 schools, and Kelly's portfolio focuses on our school-based mental health work, and I'll let her articulate what her particular portfolio is here on the Lower East Side.
Thank you, David. Kelly, thank you very much for everything. Go ahead.
Thanks so much, David, and thanks, Gail. I just want to echo that you are everywhere. I saw you at PS 142, one of our schools, you know, at that one of these back to school events, and we just crossed paths, and I was like, how is Gail? I don't know how you get everywhere. So I'm amazed by that you were able to get some face-to-face time with some of the kids and families that we work with daily. So like David said, out of those schools, we have 8 school-based mental health clinic programs. We are approved by the Office of Mental Health to provide individual, family, and group therapy on site in these schools. Because we're approved by the Office of Mental Health, we are a satellite clinic of our main clinic, which is right in the Lower East Side at 40 Montgomery Street at our Community Consultation Center. We are able to provide the resource of medication management through a psychiatrist or psychiatric nurse practitioner for children who might need further evaluation or medication management. So we're able to provide what I think is such an essential service, which is meeting kids exactly where they're at, where they spend most of their day, right? They go to school, that's where they spend their whole day. They go to after school programs. So they're often getting breakfast, lunch, and dinner at the school. And our team of therapists, which are comprised of social workers and mental health counselors, are on site at those schools to support with making sure those kids get consistent mental health treatment. What we know is that children who go to an outpatient mental health clinic, they rely on transportation and their parents bringing them, weather, having multiple children, many issues to try to get on site for their treatment. And we know that, and myself working in an outpatient setting years and years ago, that children are not able to get consistent mental health treatment in that kind of setting. So the school-based mental health clinic really breaks down those barriers and allows kids to get the services that they need. In addition, that we're able to break down a lot of stigma. You know, I've been at Henry Street Settlement, very honored to be working here for going on 10 years. And I've seen it with my own eyes, being able to see that while we have these therapists on site in the schools, kids just start to integrate that mental health is something that can be taken care of in school as well. And they're able to see these therapists as part of just their, you know, just like there's a school nurse, there's a speech therapist, there's a mental health therapist. It becomes very much an integrated part of their being in these school settings. And I think what's also essential about our services is that we're able to provide on-site crisis intervention in the moment to kids who are experiencing, you know, at-risk behavior, self-injurious behavior, suicidal ideation, homicidal ideation, maybe presenting for the first time with some sort of psychosis. And of course, disclosures of significant trauma that David alluded to that we are hearing more and more about. So we're able to be there to support the whole school community. And so we are able to be there presently while it's happening, and do a lot of the follow-up work with the family and all the school professionals that we collaborate with, the principals, the school guidance counselors, the school social workers, school psychologists, to make sure that kids are getting what they need. As well as making sure we can provide, resources for these families that they identify that they need, whether it's food insecurity or whether it's they need some parent resources, or the parents need their own mental health treatment. We're able to make sure we connect them to those services. So the other thing is our clinicians work throughout the summer. We also have, a 24/7 crisis number. So this isn't a service that ends when the school day ends. This is something that is supportive for the child and family, throughout the year, and even when crises are emerging outside of the school setting. So that's just kind of a little bit about, that's the foundation of what we do. Speaking to what David said of what we're seeing as we enter back in schools with kids entering back full time, we're already seeing an increase in referrals that we were not seeing when kids were remote. Many of these referrals are kids who are experiencing anxiety, depression, panic attacks, a lot of increase in behavioral challenges. I just got out of a meeting where principal and a guidance counselor were telling me that, just really concerned that kids just don't even know how to play together anymore in the same way. They're seeing basic challenges on the, outdoors on a playground, managing conflict and social skills in the classroom has been like an increase. There's been an increase in challenges on their end with that. There's been a real adjustment to getting kids to get off their cell phone, to get off of technology. Really separating from that technology has been a huge issue as well. So, we are, as David said, kids don't have a voice necessarily in the programs that are being implemented, but we try to make sure that the kids that we work with have as much of a voice as possible and empower them and get them involved in their treatment. And so through, identifying the concerns that these schools are seeing, we're able to step in. Our therapists are able to do a full, thorough evaluation and intake process with the family, really trying to break down the stigma of mental health, and provide them, a wraparound service, essentially. Like, it's not just the services inside of the school. We have all of these resources at our settlement house that we're able to refer to support the family. And then also meeting with the kid on a regular basis. So I will leave it at that, and happy to answer any questions in terms of other things that we're seeing. I know that one other point that was provided to me today was that kids are lacking stamina. There's a level of exhaustion that's happening in the classroom and outside of the classroom just with their adjustment back on site. So, just the scheduling, the waking up, the routine is really impacting a lot of our kids. And we are also having, like David said, advocacy issues. We're always advocating for these kids, and we are seeing some issues with transportation, with kids who've had busing on their IEP. There's been a busing shortage, and so schools are advocating, we're advocating, trying to make sure that these kids get these services. So I know everyone here is probably familiar, an IEP is a legal document, and if a kid wasn't getting the services that they need on their IEP, there would be a need to make up those services in some capacity. With busing and getting to school, that's a tricky one. There isn't a way to make that up. So we're seeing parents really struggling with, making a decision. Are they going to work today, or are they going to have to drop their kid off at school? So we're seeing a bunch of different issues from a micro level in terms of mental health with anxiety to kind of, in the classroom and in the school community on a meso level, and then more on a macro level, that there are some systems issues that are really challenging parents and kids to getting back into the school routine.
Thank you, Kelly. I think what is so helpful about what you both said is the general public does not understand the depth of that trauma. I have another one, which is I have 3 or 4 kids who want to transfer, and I don't want to use a bad word, frustrated, because the parent has some kind of underlying condition that's serious. The kid is on the subway. The kid wants to go to a school near the house because the kid is having literally a panic attack on the subway for fear that he or she will catch COVID and then bring it home and the parent will die. I mean, like, it's just deep. But trying to get no IEP, So how to get, just as an example, to get a friggin' transfer, even when I can get a school opening near the house so they don't panic because of the fear of getting the parents sick. It's the DOE doesn't understand it. So that's just another one to add to the list of when you mention transportation, it's just huge. And then the
Yeah.
other question I have, of course, is the mayor. I mean, I don't know how you want to phrase all this, but the mayor has said social workers. Okay, we got it because we advocated. I have two problems that have come up. Culturally responsive. More money is in the hospital. So apparently a lot of social workers, my understanding, that are culturally appropriate are going to the hospitals because they too are hiring. And the DOE pays less. So that's, I don't know if that's an issue. We always have this, either it's, early childhood nonprofit versus DOE, that pay issue. And now we have another one. So I'm just wondering, because you're in some schools, of course, you should be in every school and you should be paid to be in every school because then we wouldn't have any issues. But I'm just wondering how you're seeing, if at all, the rollout, even in the schools that you're not in, if it's working, if it's not working, you can say what you feel is appropriate. I don't want to put you on the spot, but we've been saying social workers and the services that you provide are the key to our future, period. So I'm just wondering, Kelly, what you think about the rollout or how you want to approach it or not. I don't know.
Absolutely. I welcome the opportunity to speak on that and giving me that opportunity. I appreciate that the mayor and everyone pushing this 500 work initiative. However, I think that there are some nuances that need to be shared out about this initiative. We are seeing on many levels in community-based organizations that there are, workforce issues and salary parity issues. We are seeing that the DOE is starting off with a salary for school social workers that community-based organizations cannot match. It's been known for a long time that hospital-based social work has paid more. We know that, when competing for positions, they may be able to get somebody who is more reflective of the community based on the salary that they're paying. And now we're seeing that with the DOE. So we're seeing, I'm a co-chair of the New York City School-Based Mental Health Committee. We put out a survey to 40 providers this summer. About 20 providers responded. When I say providers, these are school-based mental health clinic providers in New York City. Over 58% of these 20 providers shared that their staff had been leaving for higher paid DOE positions, some even being taken from the schools that they were servicing as a community-based provider. What's happening here is, of course, we're concerned about the salary parity issue and the workforce issue, but my long-term concern is that this can destabilize children's mental health in New York City. When we know that school social workers serve a really important purpose in the DOE. They are there to provide support to kids for counseling and crisis, and people want to know, so what's the difference between school-based mental health and school social work? School social workers are done at the end of the school day. They are not providing mental health treatment. They are not providing family therapy. They are not able to connect to a psychiatrist for mental health treatment and be working with that family in a therapeutic capacity. They are there working for the school and related to the goals of school. So that is academic mostly. And, of course, there's a focus on mental health, but they're not able to diagnose. They're not able to, without a diagnosis, sometimes we're not able to get certain services in place. We're not able to get, a psychiatrist involved to support with medication management. So there are many nuances to what a school-based mental health social worker does versus a school social worker. And the concern that I have is that if we are going to have this much of a discrepancy in pay, that we're going to continue to see community-based social workers leaving, not just school-based clinics, but outpatient mental health clinics, which are also functioning more on a fee-for-service reimbursement, which means they're not getting paid a salary, they're getting paid per session. And we won't have clinicians to see children for mental health treatment. And those school social workers cannot replace the mental health treatment. So we need both, right? We need to make sure that there's enough school social workers in the DOE to support the day-to-day school functions, but we also need to make sure that resources and funding are supporting school-based mental health clinics and outpatient mental health clinics, so that we don't have a situation where the workforce is all going to the DOE or all going to the hospital, and we don't have anybody there to service our kids and families for individual and family therapy. So that's the long-term issue, as well as like covering in the summer. And there's many more things that I can speak to, but those are my main concerns. We also know that social workers and clinicians, you know, one of the most important things that we get is supervision, clinical supervision, where we're reviewing cases and we're making sure that we're doing the most evidence-based and ethical treatment possible for each kid and family we work with. Something we take very seriously. When there isn't that kind of level of supervision in a school social work role, they're being supervised by principals who may not have that clinical background, right? And again, if it's supervision related to the academic needs, those principals are experts. They're going to be great, but we need to make sure that there's enough clinical support of these students and families. And so the concern is that we're seeing a lot of social workers, entry-level social workers going to the DOE, and people are saying, well, why are they going if they're not getting their licensing hours, their LCSW hours? Why would they go there? And the answer is they're going there and they're going to delay getting their license. They're going to get it slowly because the salary is significantly different than a community-based organization. So they are able to do a fee-for-service position in the evening and get their license in a slower way. So we don't have a lot to compete with there, except for licensing hours. If somebody really wanted to be a part of a community-based organization.
Okay, but that's very helpful. I must admit, we complained bitterly about the principal oversight, so to speak. And so Deputy Chancellor, they have such long names, I can't remember, but she's in charge of social worker. She is a social worker. And she said DOE is supposedly, again, this is not an answer to anything, is hiring a social work supervisor in, I think it was every district. In Manhattan, that's only 6. So it's not, and hundreds of schools and hundreds of social workers. So God knows how much supervision can actually be done. But I was like a broken record about principals cannot supervise social workers. But
Right.
I don't think I got very far. I tried. I certainly was. It was such a bad situation that the chancellor on some Zoom, Gail, I already know what you're going to say before I even said it. So
I appreciate that, Gail. I mean, my concern with that is even if they're hiring supervisors, right, that's still going to become a workforce issue because you're going to have supervisors leave. And then there's a trickle down effect because more senior staff are also what we call CFE CFE certified. They're certified in supervising interns. And then it becomes an issue in terms of being able to support the future education of social workers as well. So while I appreciate their thinking about the supervision piece, I'm also concerned about how that will continue to impact the workforce.
Yeah, no, I agree. I'm just giving you my version of hell, trying to get something done.
And I think it warrants underlining Kelly's opening line. Like we're concerned that this model will result in the destabilization of the mental health of our children throughout the city. Like I know we can get caught up in the policy and the configuration and the program design, but it really is high stakes. And I think any point we can raise it, we should. And it's a bad business model to pay more money for a less effective model. I mean, clearly there needs to be both, but I think the proportionality of the investment in each part of the system has to make sense. Otherwise, we're doing basically what we did in early childhood education, where essentially you're creating a caste system where it's going to play out over race, it's going to play out over class, and the young people that need the services the most are the ones who are going to have least access to that effective model that we're deploying down here on the Lower East Side.
Yeah. All right, that'll be our goal for the next round on social workers. But I certainly thank you, because without your guidance, none of this would be possible. And we're making baby steps, but the trauma is so huge. I am now here because obviously I'm in the Upper West Side, so I hear everything up here. I see Lucas Lewis on, he knows better than I, but their fights are going on with kids who never used to fight. because of what you just described. I mean, just tons of them. And I'm sure it's playground in school, after school, et cetera, and people are complaining to me, so even, even if there's support in the school, it's still, you can't have enough. You just can't have enough. So, I can't, this is, what can I say about how great Henry Street is? And then, of course, I know this isn't relevant, but your workforce group, I was just there. I don't know if it was Saturday, Friday, I don't know where I am, but I know recently I was with your workforce group, David Garza, and they are awesome also, so just.
Yeah, you were at Jobs Plus on,
Yes.
in the Walden Reese houses. Yeah, that's, again, place-based. I think, the work Kelly describes in the schools, we try to carry that place-based model to employment as well and have programming right in public housing. I see some Lower East Side is on the call. Hi, Val. Lower East Side in the house, as they say.
Val is a steady customer. She's so fabulous to be with us all the time. Shula or Jessica, do you have questions? Shula,
I think we're okay.
anybody else have questions? There's just a lot of work to be done, but you have covered it. Yes, go ahead. Somebody,
I believe that Ms. Jones has a question. She had her finger up, I think.
Val, go ahead. Do you have a question, Val?
No, you answered my question. That was previously. No,
Okay.
that was a thumbs up.
I think we're all set, and we're right on time because we usually try to end at 4 o'clock, and that's about what it is now. So thank you, Kelly. Thank you, David, for all your work, and I look forward to seeing you soon. And I think what we'll do, if it's okay with you, is go through this even more intently offline, so we know exactly, obviously the salary parity, I understand, but other issues that are more nuanced, as you suggested, that we can try to get them resolved, which is not easy, but we're certainly going to try.
Yeah, I think the effectiveness parity, we'd love to be able to talk about that more. And it's not about, again, casting dispersions, it's about finding the right balance. And so we welcome that conversation. Thank you.
Thank you very much. All right. Thank you,
Thank you.
everybody, and we'll see you next Tuesday at 3 o'clock. And again, much thanks to everybody who participated. All right, see you next week. Thank you.
Thank you.
Thank you, Gail. Thank you, Shula.
Thank you.
Thanks, Kelly.
Thank you, Gail.
Thanks, everybody.
Thank
Thank
you.
you, everybody.
Bye.
Bye.